Hello, welcome to my channel. I'm Dr. Shirin, a general physician. Today I want to talk about the cervical cancer. I hope you enjoy it. First of all, we want to know where the cervix is located in the body. Cervix is located in the bottom of the uterus at the junction with vagina. And we should know that mostly happen at the age of the 50 and is one of the most important and most common cancer in the women. But generally we can see at the age between 35 to 65. What is the most common cause of the cervical cancer? HPV virus or human papillomavirus is one of the most and main reason of the cervical cancer. And main way of transmission of the HPV is through sexual intercourse. There are different types of the HPV and about 90% of them are harmless and can disappear by themselves in a year. But other types of the HPV, it means 10% of HPV are very dangerous and can lead to cervical cancer, which is HPV type 16 and HPV type 18. Let's go to the risk factors of the cervical cancer. One of them is having a multiple sex partner, other is having a weak immune system, for example, people with HIV. And last one is having unprotected sex, which leads to STD or sexual transmitted disease. And also, I want to add two important risk factors for cervical cancer. One of them is smoking, and other is family history. If your family member, especially first degree of your family, had a cervical cancer, the risk of the cervical cancer can increase in your family members. Cervical cancer has a different type, but in this video, I want to talk about the two main types of the cervical cancer. First one is squamous cell carcinoma. 85 to 90% of cases have this type. And we should know that the most common type of the cervical cancer are this. Another type is adenocarcinoma, which can affect 5 to 20% of women. And usually young women can affected by this type of the cervical cancer. Now I want to talk about the symptoms of the cervical cancer. In the initial stage, women may not have any special symptoms, but during a progress of the cancer, the symptoms can be appear. The first one is abnormal vaginal discharge, can be smelly and watery, and during a time, the color can change to the dark red or brown. Other symptoms include abnormal vaginal bleeding, especially after sexual intercourse, dysuria, pelvic pain, and pain in the back. Okay, let's go to the stage of the cervical cancer based on FIGO. First stage is only limited to the cervix. Second stage can go beyond the uterus and can involve 2/3 of the vagina and also perimetrium. What is perimetrium? Perimetrium is the outer layer of the uterus which can connect the uterus to the pelvic tissue. And at the third stage, lower third of the vagina and pelvic wall are involved, and we have a hydronephrosis or inflammation of the kidney. And in the last stage, we have metastasis to the outer part of the pelvic area. One of the most important tests for detecting a cervical cancer is pap smear, and in most countries recommended from age of the 21 for women. And it's better to do these tests every 3 years. But if result of the pap smear is abnormal, it's better to do these tests every 1 year. Next diagnosis method is colposcopy. After abnormal result of the pap smear, it's better to do colposcopy. In this method, doctor uses a special device which is called colposcope to examine the vagina and beginning part of the cervix. And last one is transvaginal ultrasound, which is used for accurate image of uterus. Let's talk about the treatment of the cervical cancer. First one is cryosurgery or cold surgery. In this method, use of the liquid nitrogen or CO2 to kill a suspected cancer cells. Next one is LEEP or loop electrosurgical excision procedure. In this method, use of the loop wire heated by electrical current to remove the cancer cells. But this method has a different side effect, for example, infertility, shortening of the cervix, and preterm labor. And next one is use of the cold knife to remove the abnormal tissue and cancer cells. One of the main surgical methods for cervical cancer is total hysterectomy. In this method, uterus completely removed. Other is radical hysterectomy. In this method, uterus plus cervix and part of the vagina can be removed. Next one is trachelectomy, mostly used for young women and women who want to have baby, because in this method only a part of the vagina and cervix removed, but the body of the uterus and ovary are not removed and can remain inside of the body. For prevention of the cervical cancer, vaccination is best option. Gardasil vaccine for HPV type 16 and HPV type 18 is recommended. And also, cervix vaccine is used for HPV type 6, 11, 16, and 18. And regular pap smear test also recommended for every woman. Thank you to watching this video till the end. I hope you enjoyed this video. If you like it, please subscribe to my channel. See you in the next video.